now I'm back with everyone's favorite wizard to talk about same thing again. Dog dental cleaning and what the doctor sees whenever they look at your dog's teeth and tell you that your friend needs their teeth cleaned as well. So in this case, Wiz has not had his teeth cleaned in a little over a year, and part of that is because he's a good chewer. He will chew on the bones and the rawhides and things like that. But that's not an end-all be-all, and it doesn't fix everything. So it does eventually come down to time to do their dental cleaning. Wizard has already had a lot of his teeth extracted from an accident that he had years ago, so he doesn't have as many left at this point, and that means that for him anyway, his dental health is more important because otherwise he's going to end up being a toothless dog, and he's a little too young for that. It would be terribly sad for him. So in his case, unlike the cat, he doesn't have a lot of that red irritation on his gum line. But you can see he has a lot of that buildup on his teeth, a lot of that dark brown discharge that he doesn't need to be having. So that's the part for him that needs to be cleaned away. In his case, I don't think that he's going to need any teeth extracted. But again, one, you can see how difficult it is even for me to get his mouth open. So I don't know that for certain until I get him under anesthesia and I can do a full exam on his teeth and find out exactly what we're dealing with. So let's move on with getting this guy dental cleaning and show you what that looks like for him. So now I have Wizard under anesthesia, and since he was so resistant to having an exam done on his teeth, we weren't able to properly get a look at his teeth and make sure that there weren't any concerns. So now that he's asleep, we can really get these lips pulled back and really get in there to see his gums. And we can see that back here, this gum tissue is a little bit red and angry and irritated. So when Dr. Allgood does probe these teeth, we'll make sure that she takes a look to make sure that this tooth is stable. Does it always mean that they're going to lose a tooth when the gums are red like that? No, but it is something that we make note of and we want to be aware of now and for the future dental cleanings. All right, so now that he's under and ready, we will have Dr. Allgood probe his teeth, and then we can get started with his cleaning.
All right. So again, we're going to kind of check along the gum line, make sure he doesn't have any deep pocketing. We're getting a little bleeding there for him, just where he's got some gingivitis and some inflammation. We're going to kind of check along the gum lines for him. And things are feeling pretty good there.
So Dr. Allgood has given us the go-ahead that his teeth are all set, so now we can get started with the cleaning process. So just like we did with our kitty, we have our ultrasonic scaler that's going to use the water to clean away a lot of this debris and buildup that's on his teeth. And let me get up under these gums. So something that happens often when I'm cleaning teeth and I'm looking at other things is that I notice things that we couldn't see if we weren't looking under anesthesia. And you can see right here, he's got this strange red ulceration up above this tooth. Doesn't appear that it's actually part of this tooth or anything to do with the gum itself, but it is ulcerated in this area. That is something that when they're awake during an exam, the doctor's potentially not going to be able to see that. Again, is this something that I have to be super concerned about? Perhaps not, but it is something that will be made note of, the doctor will be aware of, and we might be watching for something like this in the future for him. It also means that I'm going to look closer at the gum tissue that's up here and check in up in his lips to see if I see ulceration in other places. If I saw more ulceration, I am going to be more concerned, but because I only see one small spot here, less of a concern and just something to make note of for his future dental cleanings. So now we've scaled the teeth and gotten all of the plaque and discharge removed from these teeth. Had the assessment of his weird ulcerated area. We're not concerned at this point. We're going to let this be for the time being. So now I just need to polish these teeth because the scaling has created grooves on the teeth that I want to smooth out so that we can't have more buildup on the teeth because of the grooves that I've created from the cleaning. So now we've polished them all up. Rinse away the polishing cream. And now Wizard has clean and shiny teeth again. So something to think about that perhaps a lot of people don't necessarily want to think about is these dog breeds that have shorter faces. And for instance, Wizard, who has an underbite, his teeth don't meet in the front and his lower jaw sticks out further than his top jaw does. His teeth are kind of crammed in here. So sometimes they do end up with instances where a tooth is turned. This tooth isn't straight like its counterpart is here. It's turned a little bit inward. Again, not anything that we're concerned about. It's just something that we commonly see with these smaller breeds because they just were not genetically designed to have their teeth as the years have progressed. So oftentimes you'll notice a doctor may call to tell you that a tooth is misplaced or is causing a problem, not necessarily that it's loose, but that potentially a tooth that has turned like this could be causing a problem into his palate or is rubbing up against another tooth and causing a different tooth a problem. So just a side note, just something to note because he is a small dog with a small mouth and an underbite, that his malformation is a little bit different and can cause problems for him as he gets older. All right, guys, thanks so much for listening.